Hello, everyone. Welcome and thank you for joining us. Our short webinar today is on solutions for the member journey acquisition. There are three stages of the member journey: acquisition, engagement, and retention. And today we're going to focus on the first important stage of the journey on acquiring new members. As we like to say at Connection DRX, pay careful attention to the member journey because it will ultimately determine the success of your member experience. We really value your time today and we'll follow up with any questions you may have after the webinar, as well as send a copy of the webinar recording. Please type questions in the box here or send them directly to marketing@connextra.com, and be sure to reference our Member Journey Solution webinar as well. Some quick introductions. I'm Aaron Davis, Product Manager with Connection DRX, and it's my pleasure to present today with Amanda Woodman, Sales Executive for our Health Plan Market segment. A little bit about Connection DRX. I'll start with a brief intro on who we are for those of you who may not be familiar with us. We are the Medicare industry market leader with more than 20 years of experience developing innovative and scalable technology solutions. Some of these include our time-tested Medicare shopping, quoting, enrollment, and retention platforms, gold standard drug pricing technology, and a therapeutic alternatives database. Connection DRX also has a vast history of collecting data that has provided valuable insights over the years. This data is part of our robust analytics platform, helping our customers connect with their end user audiences faster and more effectively. We are proven technology innovators with both hosted and API solutions. And we have learned over the years that combining data and personalization, along with speed of service, is a game changer for retaining Medicare beneficiaries. We are also experts in network distribution. We have designed and built the most robust and extensive network of agents where we connect with health plans, FMOs, and agencies to agents nationwide and agents to the products they sell. It really is this glorious loop of engagement and connection opportunities for our customers and their end users. We've come to rely upon to get more people enrolled in their best fit Medicare plans. Here's a brief history of our story. Our roots go back to 2000, when we started as Destination RX as a pioneer in drug prescription pricing and comparison. Connection went on to acquire DRX in 2013. We then refocused our attention on Medicare, where we were acquired by Harris Computer Systems in 2019. In 2020, we launched the new Plan Compare One for Medicare shopping, quoting, and enrollment. And then we launched Medicare Edge in 2021 for small to mid-sized health insurance agencies. Our customers include health plans of all sizes, from large nationals to new regional plans, FMOs, PBMs, e-brokers, and digital health organizations. Our customer base also makes us the largest distribution network in the Medicare industry. Our vast experience includes working with those who are brand new to selling Medicare, as well as industry veterans. As a result of our depth and diversity, we saw a nearly 30% increase in enrollments from AEP 2021 to 2022 across all channels and customer types. We also invest in our customers and have made some significant technology enhancements in the past year. Some of these include agent call recording, personalized videos, and healthcare cost modeling. We have expanded our product enrollment capabilities and fine-tuned our drug pricing transparency. We have made great strides in personalizing the member experience to help health plans and FMOs develop crucial outreach strategies that have led to increased member retention. We continue to find ways to help our customers offer a highly personalized shopping and enrollment experience. Now I'll pass the baton over to Amanda and kick us off for the first stage of the member journey. Amanda?
Thanks, Aaron. The journey to an optimal member experience and higher star ratings for health plans means paying particular attention to the member journey, from acquisition to engagement to member retention. In this slide, you'll see an overview of the solutions we offer for each of the three stages. Today, our focus is on the first journey of this, on the first stage of this journey, acquisition, and that's represented by the yellow icons. Our two solutions that impact acquisition are Plan Compare One, our platform for Medicare shopping, quoting, and enrollment, and the second one is BrokerLink, our extensive distribution network that connects carriers and FMOs to agents and agents to the products that these companies sell. Acquiring members is all about establishing connections and getting the broadest reach possible. It means maximizing your existing channels or introducing new ones. These channels increase awareness of your Medicare products and may include direct consumer, call center, field agents, and e-brokers. To acquire members, you need more eyes on plans so beneficiaries can find their best fit match. Plus, you need more agents who are familiar with your products so they can connect seniors to those products. We pair Plan Compare One and BrokerLink to help health plans effortlessly set up all avenues of member acquisition within just a few weeks. Through this approach, we support all channels with the tools necessary to begin capturing enrollments in a streamlined and modernized way, moving away from paper operations to better serve a new Medicare population and to save our customers time and resources. Here you see how Connection DRX acts as your central point of acquisition management, pulling in data from Plan Compare One and BrokerLink, along with that from your direct consumer channel, from your internal staff, and from external brokers and call centers. So let's dive a little deeper into Plan Compare One. Plan Compare One is our digital platform that enables consumers, your internal staff, and agents to seamlessly shop, quote, and enroll in your plans. The platform can be delivered in two different ways, hosted out of the box or via API. So we'll talk about those two options. Our out-of-the-box approach works best with those who are new to the market and don't yet have an integrated electronic solution. Those who are on a deadline and need to get up and running fast with little IT involvement and maintenance, or needing to provide a comprehensive tool set to internal agents and staff to effectively provide member support, and those who want to ensure they are compliant when it comes to all of the acquisition channels. And then our API approach works best with those who have an existing shopping and enrollment solution, either homegrown or through another vendor, that can be enhanced with our gold standard drug pricing and total out-of-pocket cost calculations. Also works best with those who want a fully customized front-end experience, but don't have the time or resources to build the back-end shopping and quoting logic. And those who also have a dedicated IT department to support and maintain custom workflows and integrations with other systems. Our data powers every kind of experience, from entering a zip code to completing an enrollment to finding a lower cost prescription drug. And our APIs keep your members on your familiar platform. So even though 90% of payers believe APIs are critical to their business strategy, with the progression of technology, this belief is surely shared among our diverse and varied customer base beyond just health plans. So this slide shows a personalized member experience using APIs that takes into account the following: multiple pharmacies, their varying prices, subsidy, age, and health status. It gives drug pricing data that is updated every 2 weeks, reliable out-of-pocket cost estimates that are delivered monthly. Additionally, we deliver the most extensive database of drugs and therapeutic alternatives. And what's even as important, if not more, is that benefit faces are reflected for each drug in the medicine cabinet. So whether you're new to the market and need a platform quickly and with little IT support, or you have an existing solution that can be enhanced to provide the best experience possible, Plan Compare One is your best bet. Plan Compare One supports all Medicare plan types, including MA, MAPD, PDP, Medicare Supplement, and ancillary products. And it also offers integration across channels, so agents can pick up where a consumer left off and vice versa. We see heavier enrollment conversion with our flexible workflows between channels, such as agents using their Connection DRX personalized URLs or shopping links. It offers personalization through preferences, so consumers and agents can personalize and enrich the member experience, which Erin is actually going to discuss in a moment. And decision support, so gold standard drug pricing, reliable out-of-pocket cost estimates, and connections to Medicare.gov are key to informed decision making. So now Erin will dive a little deeper into the benefits of personalization with preferences.
Thanks, Amanda. One of the keys to acquiring new members is getting them in their best fit Medicare plan from the start. Via our platform, we offer an incredible opportunity to personalize the member experience when agents and members input preferences. These preferences include things like health status, physicians, pharmacy preferences, prescriptions, and subsidy levels. These preferences help ensure that the most accurate drug pricing will be shown, that will in turn provide the most valuable out-of-pocket estimates. Because as we all know, zero premium does not always mean the lowest cost to the member. I'll dive into a little bit of data we pulled. So recently we pulled a data set on consumer activity within Connection DRX and found that on average, 26% of total users were utilizing preferences to personalize their shopping and enrollment experience. In a similar data set, we found that on average, users who enrolled in a Medicare plan, 24% of them used preferences as well. What we've realized is that personalization from the start of a consumer's journey can have a significant impact on their likelihood to enroll. The ability for consumers to have a more personal estimation of their cost and greater transparency of their options means that they're set up to have a more tailored interaction with a licensed agent and a greater understanding of their coverage.
The second part to the acquisition equation is BrokerLink. Our unparalleled distribution network has resulted in doubling of Medicare enrollments in the past year, with nearly 150 carriers in the network and hundreds of thousands of agents with access to these carriers in all 50 states. Connection DRX is the premier source for connecting health plans with external enrollment distribution. Quick overview of how it works. Health plans let us know which FMOs and agencies they are contracted with from our network. And through a single integration, we offer a gateway for FMOs to quote and enroll these carrier products from their Connection DRX platform. Agents can connect with more consumers online every day, and consumers enroll in their best fit plans. Health plans receive enrollments from one integration point from all of their chosen partners. To increase exposure of your plans, we make sure you show up in search results. And as Woody Allen once said, 80% of success in life is showing up. We verify all permissions and load carrier plans, pricing, and formulary data as necessary. We also configure enrollment forms to include carrier branding and any other specifics unique to each carrier. Participating in BrokerLink is an opportunity for health plans to increase their exposure, build awareness, and advantageously compete in the marketplace. So this slide shows the vastness of our BrokerLink network in some of our key states. For example, with 30 carriers in California, there are over 17,000 BrokerLink agents. This increased visibility results in more than 58,000 enrollments during AEP last year. In Florida, more than 22,000 BrokerLink agents helped 28 carriers get more eyes on their plans, resulting in 36,000 enrollments during AEP 22. So as you can see, BrokerLink is a very valuable tool. And as you can see from this slide, as a BrokerLink customer, you get an all-access network from a single Connection DRX integration point, and you can add agencies with just the flip of a switch once you're contracted. The proof of the pudding is in the number of partners and enrollments. So the number of multi-carrier partners, agencies, FMOs, and e-brokers we have onboarded has risen 70% since 2020. Total BrokerLink enrollments nearly doubled from 2020 to 2021. To date in 2022, we've already surpassed the number of enrollments we realized in the entire year of 2020. We have over 115 carriers participating in BrokerLink and showing up in the plan results for their respective geographies. Many of our new health plan participants are regional plans, which is important to note. And BrokerLink Plus, our direct consumer site, is an exceptional way for regional plans to compete, increase exposure, and better capture interested Medicare beneficiaries.
Thanks, Amanda. So as we begin to think about plan year 2024, and rest assured it's certainly on our minds too, It's important to assess your current channel strategy and ask yourself some key questions. Questions like, which channels provide the most enrollments for you? Can that channel be enhanced or improved? Are there channels you're not currently utilizing? Or does your strategy account for the different personas of the quote unquote Medicare consumer? The Medicare consumer comes in all shapes and sizes, from agents to switchers to technology users and more. And they have their own preferred way to enroll. Some are loyal to their agent, and some prefer to shop solely on their own. And their preferred way of enrolling can have an impact on plan switching, disenrollment, and other factors. Let's take a look at some member experiences according to DEFT research as they can impact your acquisition strategy. According to a DEFT research study in their 2022 studies, nearly 25% of Medicare switchers enrolled in person with an agent. In-person agents are catalysts for plan switchers and always have been. Now, call centers are enrolling more switchers. Switchers who enroll online do so primarily without help. A negative member experience results in attrition, but so does the perception that quote unquote switching plans is hard. 41% of seniors stay loyal to their plan because they think switching is too difficult, versus 25% who say it's easy. 2/3 of them say they will stay in the same plan during AEP, whether that's Medicare Advantage and MedSup loyalty, they may have researched is kind of that limit. Of note also, but not shown in this slide, is how seniors work with agents. 65% of them prefer to speak to an agent in person. 20% don't have any preference, and 16% prefer to speak to an agent online through a website. This tells us that seniors are 4-to-1 more likely to prefer in-person communication versus connecting through a website. An important factor to consider when looking at agents and your acquisition strategy is, when do agents start looking at Medicare information? According to DEFT research, the sweet spot is 3 months before turning 65. So if you get those agents early, they may signal to you when they are ready to talk. 19% of them receive help within 3 months of turning 65, 10% in the period of 4 to 6 months prior, and only 2% start looking 7 to 9 months prior to turning 65.
There are a number of ways of covering your bases for the upcoming year, and the flexibility of our offerings allow for capturing shoppers across the spectrum of Medicare without disruption to your current digital ecosystem. At Connection, we want to make sure you get a home run every time, and BrokerLink is key. So first option, BrokerLink. Use external agency relationships and access data on enrollment and health risk assessments. BrokerLink plus APIs. Use the same algorithms and tools across all channels with our API option. Pairing BrokerLink with a hosted direct consumer site, where you can capture external enrollments and those preferring to shop on their own. Consumer site is out of the box, white labeled to match brand guidelines, and gives your consumers a seamless experience between self-service and agent-assisted. And BrokerLink, direct consumer, and a platform for internal agents and staff. This is the integrated direct experience for consumers and support staff. This omni-channel strategy includes both BrokerLink, Plan Compare One together for a seamless and consistent way of acquiring members. With this strategy and with Connection DRX, you're sure to be hitting home runs with your member acquisition efforts in no time. We also want to call out our exciting Health Plan Quick Pitch webinar series. Here we offer our BrokerLink customers opportunities to increase brand awareness and plan visibility through a short 8-minute presentation to our FMO and agency customers delivered via a recorded webinar. If you're interested in learning more about this effective webinar series and the benefits, please let us know.
Thanks, Amanda. So as we wrap up today, we really want to thank you for your time, and a sincere thank you to Amanda for her insight as well. Please download our Solutions for the Member Journey ebook and take a look at our cool new video, both on Health Plans page at connecture.com. And if you'd like a demo on any of our solutions or have any questions, we highly encourage you to contact us at marketing@connecture.com. We look forward to seeing you on our future webinars. Thank you so much for your time, and have a good day.